Salsalate is a medication that helps to relieve pain from different conditions and also reduces pain, swelling, and joint stiffness from arthritis. It is classified as a nonsteroidal anti-inflammatory drug, NSAID. This medication can be taken orally, usually 2 to 3 times a day with food or milk to prevent stomach upset. It is important to follow the dosage instructions provided by your doctor or pharmacist. Salsalate can be taken at any time of day, but it is best to take it at the same time each day to help you remember. Always consult with your healthcare provider before starting or stopping any medication. When taking Salsalate, it's important to follow your doctor's instructions. Typically, you'll take it 2 to 3 times a day with a full glass of water. To reduce the risk of stomach upset, you can take it with food, milk, or an antacid. The dosage will depend on your medical condition and how you respond to the treatment. It's important to take the lowest effective dose for the shortest time possible to reduce the risk of side effects. For ongoing conditions like arthritis, continue taking Salsalate as directed. It may take up to 2 weeks of regular use to feel the full benefit. If you're taking it as needed, remember that it works best when used at the first signs of pain. If your symptoms persist or worsen, be sure to consult your doctor. If you experience upset stomach, dizziness, or nausea, it's important to let your doctor or pharmacist know. This medication is prescribed because your doctor believes the benefit to you outweighs the risk of side effects. It's common for people using this medication to not experience serious side effects, but it's important to monitor your blood pressure regularly, as this medication may raise it. Be sure to tell your doctor right away if you experience symptoms such as heartburn, changes in hearing, easy bruising or bleeding, fast or pounding heartbeat, signs of infection, signs of kidney problems, or symptoms of heart failure. In rare cases, this drug may cause serious liver disease, so it's important to seek medical help if you experience symptoms such as nausea or vomiting that won't stop, dark urine, yellowing of the eyes or skin, loss of appetite, or stomach pain. While a serious allergic reaction is rare, it's important to get medical help right away if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist for advice. Remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Salsalate, a type of nonsteroidal anti-inflammatory drug, may rarely increase the risk for a heart attack or stroke. This effect can happen at any time while taking this drug but is more likely if you take it for a long time. The risk may be greater if you have heart disease or increased risk for heart disease. It is also important to note that this drug may rarely cause serious, rarely fatal, bleeding from the stomach or intestines, which can occur without warning symptoms at any time during treatment. If you experience stomach/abdominal pain that doesn't go away, chest pain, severe dizziness, weakness on one side of the body, sudden vision changes, trouble speaking, black stools, or vomit that looks like coffee grounds, stop taking this medication and get medical help right away. Be sure to talk with your doctor or pharmacist about the risks and benefits of treatment with Salsalate. And as always, consult with a healthcare professional for the best time to take this medication and the appropriate daily dosage. Before taking Salsalate, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes any history of liver disease, diabetes, stomach/intestine/esophagus problems, heart disease, high blood pressure, stroke, blood disorders, asthma, growths in the nose, certain genetic conditions, and kidney problems. It's also important to let your doctor know about any upcoming surgeries and if you are pregnant or breastfeeding. When taking Salsalate, be aware that it may cause dizziness, and alcohol or marijuana can increase this effect. It's important to not drive or operate machinery if you are feeling dizzy. This medication may also cause stomach bleeding, so it's important to limit alcohol and stop smoking. For older adults, there may be an increased risk of stomach bleeding and kidney problems. Additionally, children and teenagers younger than 18 years should not take this medication if they have certain illnesses, without consulting a doctor first. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of taking Salsalate with your doctor. This medication can harm an unborn baby and may also pass into breast milk, so it's important to consult with your doctor before using it while breastfeeding. When taking Salsalate, it's important to be aware of potential drug interactions. This medication may interact with other drugs, such as aliskiren, ACE inhibitors, angiotensin II receptor blockers, certain seizure medications, corticosteroids, drugs for gout, and others. It can also increase the risk of bleeding when taken with antiplatelet drugs or blood thinners. Additionally, it's important to check all prescription and non-prescription medicine labels carefully, as many pain relievers and fever reducers are similar to Salsalate and may increase the risk for side effects if taken together. If you are prescribed low-dose aspirin for specific medical reasons, it should be continued as directed by your doctor. Lastly, Salsalate may interfere with certain lab tests, so it's important to inform lab personnel and your doctors that you are taking this medication. Always consult your doctor or pharmacist for more details on how to take Salsalate safely and effectively. If someone has taken too much Salsalate and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include ringing in the ears, confusion, vomiting, diarrhea, dizziness, fast breathing, and seizures. If you or someone you know may have taken too much Salsalate, seek immediate medical attention. When taking Salsalate, it's important not to share this medication with others. Your doctor may also recommend lab and/or medical tests, such as blood pressure, complete blood count, liver/kidney function, and salicylic acid levels while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you have arthritis, lifestyle changes such as weight loss if needed, and strengthening/conditioning exercises may help improve your flexibility and joint function. It's best to consult your doctor for specific instructions tailored to your needs. If you are taking Salsalate on a regular schedule and you happen to miss a dose, take it as soon as you remember. If it is close to the time for your next dose, then just skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. It is important to take Salsalate consistently and at the same time each day to ensure the best results. When storing Salsalate, make sure to keep it at room temperature and away from light and moisture. It's important to avoid storing it in the bathroom and to always keep all medications out of reach of children and pets. When you no longer need Salsalate or it has expired, it's important to properly discard it. Do not flush it down the toilet or pour it into the drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to dispose of it safely. As always, it's important to follow the proper guidelines for storing and disposing of medications to ensure the safety of everyone in your household. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.